In this lecture, let's discuss the most commonly prevalent viral infection, influenza or flu. Here is the list of objectives for this lecture. Analyze factors that put the client at risk for influenza. Assess and monitor clinical manifestations of influenza and its complications. Prioritize nursing interventions. Provide patient education on preventions, antiviral treatment, and nursing care for influenza. While flu can be year-round around the globe, it is distinctively prevalent from October to March in the United States. The responsible virus causing seasonal flu belongs to the family of orthomyxoviruses. In this single-stranded RNA viral family, there are 4 major genera, including 3 important types of influenza viruses: influenza A, B, and C. Human influenza A and B are the causative agents for epidemic flu. While influenza virus A tends to cause more serious infection than influenza virus B, influenza C rarely causes human infection. The genome of influenza virion contains 8 segments of ribonucleic acid, RNA. The pleomorphic influenza virions have a sphere shape that is enveloped with glycoprotein spikes of hemagglutinin and neuraminidase. The hemagglutinin allows attachment of virus to the susceptible cells, and the enzyme neuraminidase promotes releases of the replicate viruses from the cell. In addition to these functions, hemagglutinin and neuraminidase are the antigens inducing human immune responses, and they are used for subgrouping influenza type A viruses. Influenza virus primarily causes upper respiratory tract infection. It is transmitted via contact, indirect or direct, of the contaminated respiratory secretion, which is then introduced into respiratory tract via portals of entry, such as nose, mouth, and eyes. Close contact is the major risk factor causing spread of influenza. Therefore, schools, institutes, and enclosed space with people gathering put the people at higher risk of contracting flu. And following this trend of thought, school-age children or younger children in daycare centers, elderlies in nursing homes are at higher risk for getting flu. Adults and children with chronic heart or lung condition, diabetes, chronic renal disease, or immune deficiency are at higher risk for not only contracting flu, but also much more severe condition. The communicable period is 1 to 2 days before and 2 weeks after onset of clinical manifestations. After the virus enters the host, it incubates for 1 to 4 days. Then, an abrupt onset of signs and symptoms combining systemic and respiratory manifestations follows. Fever between 100.4 and 104 degrees Fahrenheit, which is equivalent to 38 to 40 degrees Celsius. Chills, facial flushing, headache, body ache, malaise, cough and coryza, dry and sore throat. Some patients might experience photophobia, tearing, or burning sensation of the eyes. Younger children might also be irritable, fussy, with pharyngitis, possible wheezing, and diarrhea. Rapid antigen assay test is available for making diagnosis. It can be performed on specimen collected from throat swab, or viral culture can be done. Treatment for flu is supportive and focused on symptom management. After diagnostic test, an antiviral medication can be used if started within 48 hours of the onset of symptoms. There are 4 antivirals for influenza infection approved by FDA. These 4 medications are oseltamivir, zanamivir, peramivir, and baloxavir marboxil. Flu is usually self-limiting. Most patients recover on their own. However, risk for fatality increases with complications and greater severity of flu infection. Complications include secondary infection, which is usually bacterial. Pneumonia is another possible complication as the viral infection spreads along the anatomical structure to infect lower respiratory tract. CDC estimates influenza-related deaths to be about 12,000 to 61,000 since 2010. People who are at higher risk for developing complications include the following: adults who are 65 years or older, younger children who are less than 2 years of age, people with chronic pulmonary, cardiac, renal, endocrine, and neurological conditions, as well as people who are immunocompromised. The ideal precaution is combining both droplet and contact isolation. Since most patients are cared for at home, patient education is particularly important. Teach patient and family the following. Keep patient at home until being afebrile for 24 hours without using antipyretics. Keep family members away from patient. Wash hand frequently and properly. Encourage fluid intake. Apply cool mist humidifier to help soothing the upper respiratory tract and making expectoration of the phlegm easier. Signs and symptoms of complications should be taught. Severe sore throat, difficulty swallowing, and high fever may indicate bacterial infection. High fever, flushing cheeks, chest congestion with greenish yellow sputum may indicate pneumonia. Patients should be taught on prevention of influenza. Taking annual vaccination is recommended. Influenza vaccine include purified hemagglutinin and neuraminidase from both influenza A and B viruses. Initial series of influenza vaccination is 2 doses given at 4 weeks apart. Anyone with egg allergy should take influenza vaccine with precaution. During history intake, if worse than hives allergy reaction is reported, the patient might need medical supervision when receiving influenza vaccine. 3 flu vaccines are available. Inactivated influenza vaccine can be given to infants as young as 6 months old. Minimum age of 2 years is required for immunization with live attenuated influenza vaccine, which is given via nasal spray. Recombinant influenza vaccine is an egg-free vaccine. It is used for people who are at least 18 years old. Taking proper precautions, including hand washing and keeping distance from sick family member, help preventing influenza from cutting off the transmission. Making aware of flu season and avoiding crowded place during an outbreak also help preventing spread of flu in the community. Administer medication as prescribed. Both oseltamivir and zanamivir are neuraminidase inhibitors. These 2 medications are effective for treating both influenza A and B. In addition, they do not interfere with the effects of influenza vaccines. If taken prior to exposure, oseltamivir and zanamivir prevent infection. If taken within 48 hours after onset of symptoms, they limit the severity and shorten the duration of symptoms. The common adverse effect of oseltamivir is GI discomfort, including nausea, vomiting, and abdominal pain. This side effect can be alleviated by taking medication with food. The concerning adverse effect of zanamivir is possible bronchospasm. Therefore, zanamivir is not recommended for patients with asthma or COPD. Oseltamivir is taken orally. Zanamivir is a powder drug that the patient inhales through a device. Oseltamivir is prescribed to treat early flu in people who are at least 2 weeks old. Zanamivir is prescribed for those who are at least 7 years of age. Both oseltamivir and zanamivir are given twice a day for 5 days. Some hospitalized patients might need more than 5 days of oseltamivir. The third neuraminidase inhibitor is peramivir. It is indicated for early and uncomplicated flu caused by either type A or type B influenza virus. The patient has to be at least 2 years of age to receive this medication. Peramivir is a one-dose-only antiviral medication that is given via intravenous route. Therefore, it has to be administered by a healthcare provider under surveillance. Severe hypersensitivity reaction to peramivir is rarely reported. The most common adverse effect is diarrhea, followed by decreased neutrophils, elevating serum glucose, creatine phosphokinase, and liver enzyme. Baloxavir marboxil Xofluza is the last antiviral medication approved by FDA for treating seasonal flu. Baloxavir marboxil is a polymerase acidic endonuclease inhibitor. It is indicated for patient who is at least 12 years of age with flu symptoms for less than 48 hours. This medication is taken orally and requires one dose only. Baloxavir marboxil is not recommended for pregnant women, nursing moms, people who are allergic to the medication, and those with complicated or progressive medical conditions. The most commonly used medication during flu infection is antipyretics, such as acetaminophen and ibuprofen. Antipyretics aim to manage symptoms of flu and provide comfort for patients. Encourage rest and provide quiet and restful environment within which the stimulation is decreased.